hope so, because whenever we speak of it and we get a chance to speak to the different health advocacy, professional organizations, and grassroots organizations, and everyone thinks that it's the right way to go. And as was said, we have to talk about housing. We have to talk about a lot of things, and this would enable communities to get help from HUD or from EPA for environmental issues, to be able to address their healthcare needs. So I think it's it is something that has developed a lot of support, and we have introduced it at times as a standalone bill, and also within the context of the bill. We're going to introduce it as a standalone bill again, because we think it is really the key to turning things around in our communities.
I'd like to invite our two clinic heads to come to the microphone, if you would. Hadn't planned to put you on the spot, but since you're here, I thank you for being here. Bill Tyndall, maybe you could get up and talk about the issues that are important to you. You're the front line in healthcare at Southside Health Services in South Minneapolis. And how do you instruct our community to engage and utilize the services you provide? What is the impact, negative or positive, of insurance or lack thereof? And what legislative remedies would support you in delivering quality of life to your stakeholders, your clients?
That's a long question.
It's a big question. Yeah. And you won't be able to see Bill, but you can hear him.
Well, I guess I would say I was just thinking as I was listening to people talking, that two things that are really a problem in the way I look at healthcare. One is access. People don't have access, or they do have access, but they don't have trust. And access and trust are two things. In the African American community, for example, there's not a lot of trust in healthcare providers, especially if they don't look like African Americans. So that's a problem. And it's trust for other people. If you get into the Hispanic population, it's a matter of trust, because some people maybe not have the right papers, or they're afraid they might be turned in. So that's an issue. So trust.
Let me understand that. You're saying that African American patients don't trust physicians or providers that are not African Americans? They don't trust other African Americans who are providing the service?
They don't trust providers who are not African Americans, that don't have cultural competency to work with them.
Okay.
So that's a problem, and that's been a problem since every African American knows about the studies that have been done with African Americans in terms of I forgot the study. It was in Alabama, but I remember that. Yeah, Tuskegee study. Every African American knows that. I think Native Americans know about the smallpox blankets that were passed out to them. So it's a matter of trust that's an issue within the community. But more importantly, I think that this is a new day, and people need to have more education about healthcare and how healthcare models are put together. They don't have that. But bottom line, if you really get down to it, the real thing is that people have to have a base to move up from, and most African Americans who are in poverty don't have a base. And if you don't have a base, both educationally and monetarily and economically, it really impacts your view on healthcare.
What can Congress do to help you support the work and the vision that you have to enable and empower your communities, your customers?
Well, what I'm looking at and what I'm seeing the way the healthcare is going today is that Congress, and I think even the state of Minnesota, are looking more towards community health workers. And the reason for that is that you have someone who knows the community, who interacts with people on a daily basis in that community, and can help set up lifestyle changes that would have the most dramatic impact on healthcare. When I say lifestyle changes, I mean one of the key things I heard at a conference I went last year was what they call social health. And no one's ever talked about social health. And that means when you leave any health institution and you go back to your home, what's your social environment mean to you maintaining your health? That talks about diet, it talks about your living conditions. So what we need to do is to change the paradigm of how people live and really attack their social health, which I think is a very important area right now. It should be.
Okay. And let me ask Dory Gabolo to come to the microphone and sort of expound on the same issue and the same question from your point of view. You have a companion organization, the Open Cities Clinics here in St. Paul.
Right, we're just around the corner. In our country, we're rewarded for being ill. We're not rewarded for being healthy, and we need to change that. I would hope that this, I wrote it down, empowerment zone that they were talking about.
Health empowerment zone.
Would kind of change that, make that paradigm shift so that people can be empowered for being healthy and strive for that. When you're in the bounds of poverty and discouragement or whatever socially is going on with you, you don't think about being well. Mm-hmm. You just expect to be well until something happens that says, oh, I'm not well. How do I fix it? And we need to help people while they're well so that they can stay well, so that they can be better contributors to their families and to this community. And I do agree with Bill about the community health workers, and that's what we've utilized in our clinic, because we want people to be well. We want our community to be well. We want to empower our community with those tools that they need, no matter what's going on in their life, that they can strive for wellness. So if somehow we can change that shift from rewarding when you're sick to when you're well, that'll be a great accomplishment.
Congresswoman Christensen, what do you think? I know you've got to leave in a couple of minutes. You've got work to do in the Capitol there. But before you leave, let me ask you to respond to these managers, these leaders of community health services here in Minneapolis and St. Paul and their concerns.
Well, this country spends somewhere between 3 and 5% of all of its healthcare dollars on prevention. Let me start with that. And we are going to mount a very strong legislative and advocacy effort here to change that. That will make a world of a difference. If we can focus on prevention, we do want to have access. Part of it is insurance. Part of it is having a healthcare workforce that is culturally competent, sensitive, whatever you want to call it. And to me, the best way to do that is to have physicians, nurses, community health workers, whoever, that look and speak, look the person, come from the same cultural background and speak the same language. So we need to address all of those areas. But we are going to try to make a really concerted effort to increase our prevention dollars while we work also to get everyone under coverage. One of the first things that we'll do is, I'm sure as we come back, is to try again, and successfully this time I'm sure, to pass the children's health insurance bill that President Bush vetoed twice. It doesn't go as far as we would like it to go. Maybe we can expand on it. There are approximately 9 million children that are uninsured, 6 million of whom would be eligible for SCHIP. So we will be doing that. I'm trying to see if I can capture everything that was said by the two parties. The community health workers are very important. They play a very important role. I can remember when Howard Dean was governor of Vermont, and every child born in Vermont got a house visit. The mother and child had a home visit. And it made a world of a difference. It made a difference in their preparedness for entering school. It made a difference in enabling them to address some of the problems that were occurring at home through referrals. So a community health worker has got to be the bedrock of our healthcare system if we're going to see change. People from within that community who have the trust of that community, who can not only help people get to the healthcare that they need, but also support them. Sometimes it's difficult to test your sugar every day and take your pills on time and eat properly. So to give them the kind of support that they need to really live healthy lives.
Great, thank you, Congresswoman Donna Christensen. Now, she may be leaving us here. We keep losing our signal, but thank you very much. When we come back, I want to talk back to Dr. Williams.
Yes,
Dr.
Absolutely.
Okay,
Has a lot to do with it.
We're back. Dr. Williams, let me ask you to respond to that as well. And one of the things I want to ask you, you recently caused a firestorm in the national media by challenging whether health plans